Hello, everyone, and we are so excited here at Radio 1 to bring you When Black Women Unite. I am your host tonight, Shariah Green. I'm an integrated marketing specialist here at Radio 1 Raleigh, and I go by the Marketing Enthusiast. I am so excited to have a wonderful panel of women who are going to talk about how we can come together as one to unite women as a whole as we come to a close to Women's History Month. So let's get this amazing thing started. We're going to start off by introducing you to our first guest. Cheryl, will you please join us today?
Hey, Shariah, glad to be here. My name is Cheryl Parquet. I am the Director of Community Engagement and Marketing Activation at Blue Cross and Blue Shield in North Carolina. I'm so happy to be here.
Wonderful, and thank you. I love the blue. You represent.
Thank you.
And our next guest, Dajah, tell us a little bit about yourself.
I'm very excited to be here. Thank you for having me. I am Dajah Stallings. I am a current graduating senior at the University of North Carolina at Chapel Hill, and I'm also an entrepreneur. So very excited to be here.
Yes. All right. Thank you. Next up, we have Janine joining us today.
Hi, I'm Janine Brunson-Johnson, and I'm the promotions director for Radio 1 DC, and I'm a podcaster.
Hey. All right. Come on up, Jasmine. We're ready to talk to you too. Tell us a little bit about yourself as well.
Hi, my name is Jasmine Marshall. Thank you for having me. I'm also a senior at UNC Chapel Hill. Dajah Stallings is actually one of my line sisters.
And then next we'll have Melissa.
Hi, everyone. It is truly an honor to be here. My name is Melissa Elliott. I'm the founder of Gang Free Inc., a nonprofit in Henderson that primarily focuses on youth and food insecurities.
Hi, everyone. Thanks for having me. I'm Nicole Plenty. I'm a double board certified OBGYN and maternal fetal medicine specialist, which means I get the pleasure of taking care of high risk moms that may have high blood pressure or diabetes or history of stroke or cancer. And I also diagnose fetal anomalies. I'm also a co-host of a podcast with Janine, who's also on the panel.
Hey, welcome. We're excited to have you. And that's awesome. A Black woman in the OBG field. Thank you. We're excited to have you. Dr. Nicole.
Hi, thank you for having me. My name is Sonia Alleyne. I'm the author of I Kick Ass at Work, the career strategy journal for professionals. I'm a podcaster, Business First with Sonia Alleyne, and I run a company called Storytellers, Words, Images, Magic.
Hey, good afternoon. Thank you for having me. My name is Stormie Forte. I am an attorney here in Raleigh, but I'm also on the Raleigh City Council and have the pleasure of being the first African-American woman to serve on the Raleigh City Council. So thank you for having me on the show today.
Yes, and thank you all for being here. We are here for Black Women Unite. Let's celebrate that, ladies. All of you look amazing. We have a dynamic panel of women. So from every age background, obviously from different careers, and we have women coming into graduating college and saying she's already going to be an entrepreneur. Okay, Dajah? So I'm excited, you guys. And we're going to go ahead and kick this off. One of the things that we're going to bring up today is addressing insecurities. And so we have a lot of our special guests here are going to talk, but we're going to launch this one off with Cheryl. And Cheryl, we just want to this is nothing. I just want to address what we as a whole, women as a whole, whether you're 18, 19, 20s, 30s, 40s, the insecurities and that we have to face and the competition that we have in our community as a woman as a whole. Anybody want to elaborate and talk about some things that you have faced and how you might be able to combat those insecurities that you're battling either today or in the past? So I'll start off. One of the things that I would say as far as insecurities, for me, launching into career as far as marketing and sales, there's not many women alone just to start off with in this particular field. So finding that in joining this particular field, I found there's always competition, of course. So what I want to kind of hear from you ladies is how you deal with battling with your own insecurities and how you can make this competition more so a pact. Instead of us competing against one each other, where you notice this is a person who might lack or have a strength in some area or lack of strength, in some area that you might be able to complement. How do you think we can come together instead of, pushing each other down and making each other feel bad about their weaknesses, how we can probably enhance them and help them with their growth?
And so I'll take that. So I'll just come out and say, I work at Blue Cross and Blue Shield, North Carolina. And a lot of times it is a very male-dominated workforce. And so a lot of times Black women in our company feel like there's only enough room for one. There was a time in my career where, as we were individuals starting to move up, people kind of felt like other women were pulling them down. And one thing that I was always proud to say is that, hey, there's enough for all of us to get to the top. And I think, like you said earlier, like, how do we continue to help each other? But it's about mentoring each other. It's about bringing other women into the room with you when you have a seat at the table. And it's also about encouraging people. A lot of times we have individuals that are stuck in roles. How do we start to work with those individuals to start to give them opportunities that we didn't have? And so I think a lot about mentoring and just bringing people along with you through your journey.
For you enjoying this position, did you have a mentor? Was there a person that you could look up to that kind of helped you move up into this position? And then how do you give back and kind of carry that torch and allow people to understand that that is not a shame to do, a bad thing to do? How can you encourage more people to feel comfortable with pulling someone else up with you rather than being a crab in a barrel?
I'll say for me, so one of my mentors was Marianne Black, and she's no longer with us. But when I was young in my career, Marianne took me under her wings. And not only did she teach me the ropes about being in community and giving back, but she also taught me about being in the boardroom and having a seat at the table and the importance of giving back. So a lot of times I just think it's important for us, again, when we have that seat at the table, inviting other people along with us in that journey. I also think about, so many times, I'm a first generation college grad. So I didn't have the understanding of what it meant to, do a lot of study abroad or take opportunities with internships. But today I am always encouraging young Black women to take those opportunities, to take those internships, whether they're paid or unpaid, and get that experience.
Agreed. And I was going to elaborate on that specifically because for me, I was going to go into like the family structure as well and the lack of support. I am a person who is a first generation college student. Anyone else here have that story? First generation college student? All right, hands up. Yes. And then so I see that we have others who can say that they had someone to help them out. So would you say that a lack of support has an impact on, or family structure has an impact on a woman as she continues to, matriculate into the world after high school into her career?
Yeah, even to your earlier point, I mean, in terms of battling insecurity, it's really important to have mentorship, which means sometimes we have to ask for the support. So a lot of times we think that, a mentor will arrive or show up. And I think culturally, we always feel like we can do it on our own. Like we don't share a lot. We don't talk about our struggles. We always want to look like we have it together. And the only way that we're going to make it in a job or through entrepreneurship or in life in general is to ask for what we want. And we don't tend to do that. And so what I always recommend to my mentees is that you have to have like your own board of advisors. So you have to find people who will mentor you, people who will advise you, and people who will guide you. And a lot of times you have to actively seek that out. And I think that's something culturally we have to overcome, because it's okay to ask for help. It's okay to say, I can't do this on my own. And it's okay to say, I don't know what to do next. And so we have to be brave enough, like I said, because if we're overcoming, it's a cultural thing, to be able to ask for the help that we need.
I was just going to add to that point. It's definitely, even being here, I've had to ask for help. Currently, my boss now is a Black woman, and she has been super supportive and helpful. However, I have reached out to other Black women in the sporting industry, which is the career path I choose to go into post-grad. And other Black women aren't as supportive and helpful. It's also been kind of discouraging because it's like we're going into a white male dominated field, and you would think that you could reach out to Black women to be your allies, to be helpful, to be encouraging, to be supportive. And unfortunately, that's not the case. So when you talk about mentorship and support and things like that, it's important to remember that even when you reach out, some people may not be willing to offer that support, and that's okay. You just have to look for the people who actually are willing to help. And I just want to give a big shout out to my boss, Kyra Kendrick, who is the director of on-campus recruiting here. She has been super supportive in my journey here and helping me find opportunities post-grad.
And I think that's a major impact.
I just wanted to kind of chime in on the insecurity piece. The way I deal with that, because I'm in a nonprofit, I started a nonprofit from the ground, and there weren't a lot of resources, and people don't like to share. For some reason, there's a competition. And so for me, there's an African proverb that says, like, if you want to go fast, go by yourself. But if you want to go far, go together. So I try to promote partnership and collaborations because we could do it much better together. So that's how I deal with insecurities.
And I agree. You know, I'm an advocate for joining forces. Please do not try to do anything on your own. I know a lot of people want to, I got out the mud mentality, you know. Why do I want to come through the mud if I can come through with a few people who can help me out? You know, I don't want to do it all. I can do things by myself, right? I can be independent. I can do the research, but sometimes there's experience that cannot communicate what I read in this book, you know? So I would say, as we forge into this next subject and we talk about mentorships, that was one of the other major points we wanted to talk about. And, you know, obtaining mentorships, do you find that they're available for you when you're coming fresh out of school? I would say for Dajah and Jasmine, and for you all, for mentorships, is this something that you found through internships, actually, you know, forcing your foot in the door, or how did that actually come out to you? For me, I always had a person who was willing to give their hand out, you know, just say, Shariah, I'm taking you under my wing. They saw something in me and they always supported me. So I will say that I am blessed to say I had an advocate of strong Black women who always stood beside me, but I cannot deny that there were those who would just turn their eye when I did reach out and ask, and I would be discouraged. But for you and the power of mentorships, how do you say you open these doors, and are you opening the door yourself? How is this happening?
I would say for me, I think my most impactful mentorship was actually kind of formed organically. I'm a business student at UNC, and there was a Black woman working in an administrative position in the business school. And she kind of just took me under her wing and introduced me to an actual formal mentorship program, which was a lot of like professional development. And I think that opportunity alone opened up the door to many of the opportunities that I've had as a result throughout my college career. So I do think that I value kind of the organic relationships that form, but also through my internships, there have been kind of formal mentors that I've had that haven't been as impactful for me, but it's still nice to kind of have that formal structure coming to a company as a minority where it's primarily white men. Kind of just having that extra support system has been helpful as well.
And for you all, when you say, as far as we have one here, what can we do to help young ladies get there sooner? What can we do differently? Is this high school? Is this middle school? What can we do differently to help them get to this level sooner? Reaching out and allowing our women to learn to be more open. When do you think this starts?
It starts when our kids are babies, actually. It starts as young as they can receive information and see information. Because when I think about all of the positions that I ended up experiencing, I didn't even know they existed until I got close to the position. And so, you know, for someone to be able to dream about what they can do, they have to be able to see it, right? And so when I was growing up, it was Barbara Walters for me, because she was the only person on television who was interviewing at that level and reporting at that level. She was the only woman. Oprah wasn't there yet. And so we have to expose our kids to as much as we can, as early as they can, so they can start seeing things and dreaming from when they're young. Because many of us, I mean, we all evolve at different stages, but some of us have these dreams about what we want to do from the time we're babies, we're 5, 6 years old. And so we have to be able to create experiences for people to be able to see that earlier in life.
Thank you, Sonia. And Dr. Nicole, we're going to segue right into you too next, because you are the healthcare professional. You are a woman in a male-dominated industry as well, and a double minority in this industry. So we want to talk about issues with healthcare and the disparities we might find in women. So for you in the healthcare world, have you seen, what kind of research have you found that really affects us, and what type of knowledge we lack as far as our healthcare and best practices goes for women as a whole?
Well, thank you for having me. And I think that Black women, and not even Black women, Black and brown women, obviously have a higher rate of a lot of different complications, meaning heart disease. There's a higher risk of breast cancer and triple negative breast cancers, and we have less access to care. And because of the mistrust in the healthcare system, although we know we're at higher risk for complications from different health disparities, we don't seek out the care that we need as early as we should, because historically, because of systemic racism, which is prevalent still in the healthcare system. So me as an OBGYN, I do women's health. I treat a lot of women that may have issues with infertility, may have issues with fibroids, as well as recurrent miscarriages because of their fibroids. And then I also have to take care of women that have a higher risk of dying in pregnancy because of preeclampsia and other hypertensive disorders of pregnancy. So I try my best to educate people to make sure they understand that they should ask questions when they go to their doctor's office or to the hospital, so that they're not just sort of blowing off their symptoms and just sort of sucking it up. And then it's too late and they're having major complications. So for me, it's a matter of educating people, making sure they feel comfortable asking questions. And I always tell my patients, you should never leave the doctor without knowing exactly what's going on. Because if you don't know what's going on, then that can lead to a world of trouble later on.
Mm-hmm. Do you guys think that a lack of opportunities for Black women creates this space for awareness, as far as our health disparities go? Are you knowledgeable? Do you feel as if this is something that we are health-wise? I know I can go by my family's own health history, your family history, right? But when it comes to these disparities, sometimes these things aren't always talked about. So what can we do to keep ourselves more aware of these things and who to contact? How can we find more women like you who look like us and be able to contact and reach out to them for your type of assistance?
I believe the first thing is making sure people go to their wellness visits, right? So you're not going to know what's wrong with you if you don't get a checkup. So making sure that you're actually going to your well woman exam. When you turn 21, you should be having a pap smear, an annual exam. Every 3 years, you should be having a pap smear. Every year, even without a pap smear, you should be going to your primary care physician. So I think the first step is just making sure you're consistent with your actual wellness. Second thing is, make sure that we know that we're not supposed to be eating some of the stuff that we're eating. So trying to maintain a healthy weight, as much as we don't want to admit, Black and brown women do have a higher rate of obesity than our Caucasian counterparts. We know that obesity leads to a lot of other complications down the line, like hypertension and early onset diabetes. So if we can do things to prevent the obesity itself, or lose some weight to decrease your risk of complications of obesity, we will be better off. People can, I always tell people, look for doctors that look like you. Like, don't just go and accept whatever doctor is out there just because, oh, you saw this person on, the website. Really do some research. You can look at videos. You can literally Google Black doctors. If people needed help, you can follow me on social media. I'm just at pregnancy_pearls on Instagram. And I've helped several people find physicians that are Black and brown that have specific expertise in different areas of infertility, as well as all areas of healthcare.
Okay. And so, as you mentioned, health conditions that are disproportionately impact Black women, such as uterine fibroids, as you mentioned, and they receive little to very any government assistance. One of the things we want to know is how do we allow them, there's a lot of disbelief when we say that we're in pain or I've had this issue, this isn't working. Are we saying something wrong when we say, oh my God, my head is hurting and we're not getting prescribed the right medication? Is there something that we have not figured out how to communicate our pain differently to where we're not being served better? We're getting the same treatment when we address our health issues as far as mental birth as well. I would say I have my own story. I was diagnosed with postpartum cardiomyopathy after my firstborn. During the time, though, a lot of the challenges that I faced was that they didn't believe I was in pain. And I would say, oh, this hurts, but it's your first pregnancy. It's normal, is all I kept getting. And then it wasn't until after I had my son and I continued to have complications, and it was literally about 2 weeks later that I actually was diagnosed with the condition. And I know it comes afterwards, but again, there were things that I felt with my body, things that I was saying that it just wasn't working. So I would say, would you find, is there something that we're not saying right or what we could do differently? Or is this pretty much common, is that our voices aren't heard usually?
Unfortunately, systemic racism in healthcare is a real thing, right? Okay. So the American Medical Association finally this year just decided we collectively together said, hey, there's a public health crisis, that there is racism that exists within the healthcare system. And it's a real thing. There's been study after study that shows that pain scores in Black and brown women aren't taken as seriously as pain scores in Caucasian women. And for the most part, people that look like us don't complain as much. So, if we're not very persistent in terms of what our diagnosis is, or if we are, going to suck it up and stay at home, or we don't make people give us answers, they will blow us off. And I think it's sad that we have to be that persistent. But we really do, because everybody doesn't look like us, right? There's only 2% of physicians that are African-American women. So the rest of everybody else is not African-American women. So if you are not going to somebody that can relate to you or relate to your barriers, then yeah, you have to make sure they understand, like, no, I am not functioning with this type of pain. I'm really in pain. No, I am not breathing the way I usually breathe. Right. Something is wrong, and make them do a workup. So you really have to make them prove to you that you're okay, and not have them just explain away your symptoms as something that's just, typical because you're overweight, or typical because you're pregnant. But it happens. But persistence is key. Making sure that you get answers, because, our Caucasian counterparts, they come in our offices and they want answers. They don't care if they're being rude. I find that a lot of us, we don't want to be offensive, right? We don't want to be a complainer. We don't want to be offensive. We've mentioned it a little bit, and we're waiting to see what the doctor will say. And if they don't say too much, then we're not really going to elaborate on it. Well, if you have studies that show that, unfortunately, the majority doctors don't care about us the way we need to be cared, because there's a cultural breakdown there. They don't understand our dynamics, or if we say something passionately, it comes across as rude. If you know that, then you have to really be persistent, and you shouldn't care whether somebody thinks that you're being rude or you're being difficult. You should be persistent. If something's going on, you should say so. Constantly say so.
I agree, Dr. Nicole Plenty. Yes, because if it wasn't for, I would say we go back to support, family support, people understanding what you're going through. I would say if it wasn't for my mom consistently advocating for me, I was just like you just described. I was like, well, maybe I'm okay. I pushed that. That's why it took 2 weeks for me to actually push forward, because I was like, well, they told me I'm fine. And she was like, no, you're not. No, you're not. So we had to go back for a second.
Cardiomyopathy, you're not breathing.
You're not. And I was like, I'm okay. But she was like, it's not normal. But like, as you're saying, though, you have to be an advocate for your health. It's not as, but you're afraid. I admit that it was the doctor saying, oh, you're young. So there is that you're young and you're healthy. And I was like, but something doesn't feel right. And so I get exactly what you're saying, to be an advocate for your health and fight for it. Because if it wasn't for my mother being a little bit more persistent, I probably would have been tortured for a lot longer before I actually got real medical assistance.
Or something really bad could have happened. I mean, Black and brown women are dying in childbirth, and not just in childbirth. That 6 weeks postpartum course, you are more likely to pass away after you have a baby than when you're actually pregnant. And that's because the most common thing would be preeclampsia, and the cure for that, or that's when you have high blood pressure and vascular damage. And the cure for that is delivery. So most people say once you get past your delivery, then you must be fine. But studies show that you are in more danger after you have that baby than in pregnancy. So there's been story after story, case after case that's been reviewed, and moms that are 2 or 3 weeks out that just collapse. So I'm glad that your mom was really persistent, because cardiovascular disease is one of the #1 causes of maternal mortality.
Yes. And so as you're talking about maternal mortality, I'm going to read this, guys, so bear with me. It says, and injury rates are higher for Black females, as you're saying, irrespective of income or education level. Irrespective of income or education level. I just want to reiterate that this is not about poor or old. Black women are 3 to 4 times more likely to die, as you mentioned, from pregnancy related complications than white women. And Black women are also 3 to 4 times more likely to suffer from a severe disability resulting from childbirth than white women. For you, is this why you decided to get into healthcare, Dr. Nicole? What led you to your career, and why are you still passionate about it today?
So I'm really passionate about this subject because initially I wanted to be an attorney. So high school, just like we've been talking about mentorship and seeking people out, I happen to have 2 Caucasian people that were my coach for mock trial, and I made them my mentor. So I want to make sure we understand that as Black women, we do not have to have Black women mentors. We should have every spectrum, male, female, white, Black, Hispanic. You need everybody in your corner, not just Black women. You need everybody, because if you're trying to move up the ladder, we already know there are less Black women in the C-suites. So you need to make sure you have, I'm sorry, a bald-head white man also in your corner. I hate to say it like that, but I can't keep it any realer. Yes, that is the whole reason I went into medical school. I had a cousin that passed away at age 23 from complications of preeclampsia. She was healthy, she was thin, she had no medical problems at all, and she died, right? She had shortness of breath. She went in, they told her to go home, nothing was wrong. 2 days later, she collapsed. She got rushed to the emergency room. They diagnosed her with pneumonia. She went into a coma and never woke up. Right? So she ended up having preeclampsia with an eclamptic seizure, ended up having acute respiratory distress syndrome, and she died. And why did she die? Something that could have been prevented, right? Like, had she been taken seriously 2 days before, she could probably still be here, right? She would still be here. She would be 40 here with her 2 children. But she's not here. And so, yes, that is the whole reason. I'm very passionate about women knowing how to advocate for themselves. That's the whole reason I created Pregnancy Pearls podcast, so that women can follow other women's stories and learn from each other, so that we know what questions to ask. Hey, if you listen to the podcast and you have certain symptoms, hey, maybe I have these symptoms. I've had these symptoms. Let me go talk to my doctor about X, Y, and Z. Yes. And even on the podcast, I'll say, if you have this, you need to go and tell your doctor X, Y, and Z, and make them prove to you that you don't. Because nowadays you have to make people prove to Black women that they are okay, because we die at such a higher rate than Caucasian women.
And I thank you for elaborating on that, because this is a topic that is very sensitive, that we're afraid to address. So I do appreciate that, Dr. Nicole. And Janine, I need to tap into you on this side next, because as we talk about, being an advocate, we want to talk about coming together with women as a whole. And I would like to bring in some of your sides and kind of hear how you feel as if how we can pull our forces together to create our own table instead of having to pull a seat up to another person's table. So tell me a little bit about how you think that how we can do that as far as women and we coming together, creating our own table. Is this possible? Can we create our own table, or should we just try to keep pulling the seat up at other people's?
Well, I think that both are important, right? Like, I think that until we are able to create our own table, you keep pulling a seat up at the table, whether you're invited or not, right? Yeah. So you keep being persistent. Like Nicole said, the people that you see, they might not look like you. They might not invite you to the table. So you have to pull a seat up. But I think that it's really important to remember that, like Sonia said earlier, that there is enough room for all of us. You do not have to dim someone else's light so that yours can shine. And we have to remember that. Like, so often we're led to believe that there's only one seat at the table, and that, there's already a Black woman there and we don't want to step on her toes. Well, you can be at the table next to her. You don't have to step on her toes to be there. You can help her, you can support her, and you would hope that she would do the same. So I think that it's really important that we remember that we're all in this together, and that we're all trying to get to the same place, and that once we get to the table, we can then pull up seats for other people. We don't have to shun people away from the table as it's been done to us.
Yes. I like that. We don't have to shun them away, although it's been done to us. And I think that's great that we continue to still be inclusive to our other people, despite the disparities and obviously the inequalities that we face in every sector. And before we come to a close, I wanted to see if Dajah, Jasmine, or Stormie, anybody had more to elaborate on this topic as far as a seat at the table and uniting women as a whole. Do we let men come to the table? I'm just playing. Look, everybody laughed. I think that's a no. I'm just kidding.
Yeah, happy to echo all the sentiments that have been expressed today as it relates to mentorship and, you know, how we engage in an active network to bring each other along. I know you talked about earlier, how do we get younger kids involved? And I definitely think reaching back to folks in our community, particularly kids who may be similarly situated to most of us, you know, coming into households where they don't have anyone who's got a college education, you know, reaching out to those young ladies and figuring out ways to engage them in activities throughout the community and make sure that they've got strong mentors that can help lead them through the process of getting their education and starting them on their career path. So I definitely think all the comments that have been made today are especially useful in our community.
Certainly.
May
Well,
I add one more
everyone-
thing? I think that, especially in my career field, and I'm sure that you're aware of this too, because we work together, but it's really important to form really good relationships. It doesn't necessarily have to be a mentor per se, but forming good relationships will take you further than any education, any elevation that someone else gives you will take you. You never know where you're going to meet someone again. And it's really important that you treat everyone with the same respect that you want them to treat you with, because I've seen so many times, time and time again in this industry where, you know, you think somebody is beneath you or you don't have to deal with them because they're an assistant or, you know, so on and so forth. And you kind of just like, you know, kind of shun them. And that's, you know, that's probably one of the worst things that you could do, especially in the media industry, right? Because the industry is super, super small, especially for African Americans, and even smaller for African American women. So we have to remember that the person that might be the assistant today might be the executive tomorrow.
Yes,
so
ma'am.
You have to treat everyone with a level of respect and dignity that you want them to treat you with. And also remember that relationships are super important, because that same assistant, it might be the one that gets you the meeting that you need for your next promotion. That same assistant might be the person that pulls everything together for you, or might make the phone call that you need. So you just have to remember that relationships are super important in any industry, but specifically in the media industry.
Yes, agreed. And I can't agree with I agree with everyone's comments today. Again, I appreciate every single one of you, because it's a conversation that's definitely needed. And we were able to elaborate, but I know with the restricted time, there was so much more that we could have probably elaborated on. I know. And we just, so there was a lot of key hot topics. So what I want to do is just, as we continue to move forward, all of us who are here today, let's go ahead and just continue to spread this light to women. This does not have to be the last day that we communicate this message. It can carry on forever as we continue to mentor, as you say, continue with these relationships. So I hope to stay connected with all of you. And everybody, please be sure to join us again next time for When Black Women Unite. This has been an amazing panel, and everybody has contributed so much valuable information. And I can only hope that you gained all the knowledge you needed today, and that you go back to each and every single one of these women to connect and utilize them as a very, very, very valuable resource. Thank you again. Thank you very much.
I'll just say that as we come to a close today, how important it is for mentorship. And I would encourage everyone to go out and find a mentor, whether it's informal or formal mentorship, in our community, in your professional space, within your church. I think you can find mentors anywhere. And thank you for allowing me to be here today.
Definitely want to second that. Me personally, going into the workforce, I have been active in taking the initiative to find mentors and different sources of support, and people in positions that I want to be in, connecting with them. But this also, I am adamant about, once I'm in a position to put other Black women in those positions, that's what I want to do. So I think it's also like, yes, me taking the initiative to reach out, but also there has to be a space where you can create spaces for other women to come up the ranks with you. So again, thank you all for allowing me to be here tonight.
Hi, thanks so much for having me. If you would like to be mentored, you can follow me on social media at pregnancy_pearls on Instagram and at pregnancy pearls on Facebook. And also subscribe to the podcast. If you want to be mentored, just send me a DM. I'm always here. If you want to get pregnant or get pregnancy advice, I'm here as well. So hopefully we'll stay in touch in the future.
Echoing what everyone else said, thank you so much for having me. I gained a lot of knowledge, I think, from everyone that spoke. Everything was very insightful. I'd love to connect with some of you all after this, but if anyone wants to connect with me on LinkedIn, my name is Jasmine Marshall, same as what you see here. So that would be great.
I am super excited to connect with all of you all. You all have been a pleasure. And I would love for you all to connect with me. My IG is Oh That's Deep BWC. And that's the IG for our podcast, where we actually discuss issues that pertain to Black women. And I think that the one thing that I want to leave is, you know, we're super strong, but we don't have to be always. And it's okay to need help. And it's okay to reach out to your fellow Black women and ask for help, whether it's mentorship or just, you know, advice. Don't take the world on your shoulders, because there's no award for being burnt out at all. So remember that you don't have to go this alone, and you have a community of other Black women that are here to support you.
This was a pleasure. It was great meeting you all, and I look forward to connecting with you all. And what I'd like to say in parting is that if an opportunity shows up, it means you're ready. And it's just important for you to ask for the support to guide you through. Everything you need to know, you will learn along the way. If you'd like to connect with me on LinkedIn, it's Sonia Alleyne. And on Instagram, it's at Sonia Alleyne. It's at I Kick Ass at Work, and Words, Images, Magic. And I'd also like you to subscribe to my podcast, Business First with Sonia Alleyne.
Hey, it was a pleasure having an opportunity to participate and share the stage with everyone. I'm on all social media platforms under my name, Stormie Forte. Certainly, if you've got any questions about politics, government relations, even business consulting, you know, diversity, inclusion, equity, those types of things, feel free to reach out. We'd love to connect with folks and keep the conversation going. Thank you.